Thank you, Dr. Yadegar, for being here today. Really appreciate being able to speak directly to the source. And the goal here today is going to be helping people with their anxiety about COVID. First, I'm going to introduce you for everyone who, most people know you, but just in case around the globe, there are people who may not. Dr. Yadegar attended University of Southern California Keck School of Medicine, where he also completed his internal medicine residency and pulmonary and critical care fellowship. He oversees 20 physicians across 2 hospitals in Tarzana and West Hills, California. He's been in practice over 20 years and serving as the medical director of the intensive care unit for the past 10 years at Providence Cedars-Sinai Medical Center. Thank you for being here today, Dr. Yadegar.
Thank you for having me, Melissa.
Thank you. What has changed regarding your treatment of COVID early on and today, and how did you realize what to do?
It's only been about 8 months since we started treating patients with COVID, but I would say it has vastly changed over those 8 months. In the initial few weeks, we were advised by our colleagues, our critical care colleagues in China and Italy, that these patients, a certain portion of them get very, very sick. When they do get sick, you need to put them straight on a mechanical ventilator, on a respirator. They told us not to use any of our other modalities that we use to try to avoid placing patients on ventilators. Those are things known as high flow oxygen or non-invasive ventilation with BiPAP. The fear was that these modalities would increase the aerosolization of the virus and cause the nurses, the respiratory therapists, and the doctors caring for those patients to contract the virus. Unfortunately, after a few weeks, it was very readily apparent that this was the wrong thing to do. When patients were put on a ventilator, their disease got much worse. And they didn't stay on ventilators for hours or days. It was weeks and weeks on mechanical ventilation. And we soon saw that our ICU was being overrun with patients on mechanical ventilators. And we actually ran out of medications. When you put a patient on a respirator, you have to sedate them. You have to put them on an induced comatose state. The main reason for that is because the tube that goes into the lungs is very uncomfortable, and patients are gonna, if they're awake, they're gonna fight that and fight the ventilator. And within a 2-week span, my pharmacy director contacted me and told us that we ran out of the medications that we use. And we had to go back to medicines that we're using 20, 30 years ago, believe it or not. So it was just, it just became readily apparent that this was the wrong thing to do for these patients.
Thank you. There are people who still discuss, not physicians, of course, but hydroxychloroquine. Does it work in any point in COVID? Some people say add azithromycin with zinc. Maybe it'll help early on in COVID before it's too late. And why don't you use it anymore?
In the initial few weeks and months, azithromycin and hydroxychloroquine were the medications that we're using predominantly. I would say that it did not work for our hospitalized patients. Many of them, we started on that regimen, and within a few days, they continued to get worse. And it didn't seem like it was really playing any kind of role in their disease state. Now, that being said, these are patients that were already in the hospital. And if you remember, in the first few weeks, we also didn't hospitalize anyone unless they were super sick. They needed to have to be on oxygen before we put them in the hospital. So it didn't really play any role. And in subsequent studies that have been done on hydroxychloroquine in hospitalized patients, it did not show any benefit. There wasn't any studies done in an outpatient setting. So I think the outpatient role of the hydroxychloroquine still needs to kind of be figured out. But as of now, there really isn't a role in a hospitalized patients for hydroxychloroquine.
And when is it too late for a patient to get help once they've had COVID?
So that was the other thing that we're initially told in the first few weeks of this pandemic, which was don't hospitalize these patients unless they need oxygen. Don't hospitalize these patients unless they're very, very sick. So in the initial first few weeks, I was being contacted by my ER colleagues who had a patient who, under normal circumstances, if they had influenza, if they had bacterial pneumonia, we would have admitted those patients. But in the first few weeks, because of what we were advised, we sent these patients home. And it was very difficult because that wasn't our routine. And both the ER doctors as well as myself felt very uncomfortable sending this patient home, because I think in the back of our minds, we knew that they were just going to get sicker and they were going to come back. And that's usually what happened with those patients. And when they came back, they were much sicker, and we had less of a chance to try to treat them and try to turn the disease around. In the first few weeks, we were holding town hall meetings, which a lot of the doctors were attending. Now, a lot of doctors were not coming into the hospital, and a lot of doctors at that time had closed their offices. So the doctors that were attending the town hall meeting would always ask, what do I do with this outpatient? And in the first few weeks, we would tell them, don't send those patients into the hospital unless they need to be on oxygen, unless they're very, very sick. But that was another thing that we reversed within 2 to 3 weeks of starting to treat these patients. And I informed our colleagues, our internists in the community, that no, what we're told to do is not the right thing. We need to treat these patients earlier. We need to get them into the hospital earlier, because it was very readily apparent that by the time they got sick and they needed to be on a ventilator, you really couldn't do much to change their course.
Thank you. And as a hypnotherapist, I help people over Zoom with their anxiety. So I've gathered a list of questions from my clients and friends over the weeks following up to interviewing you. So I feel very blessed for them and for myself to be able to go right to the source again, like I was saying, instead of being fearful over what we hear from friends, from articles, from the media. We get to hear straight from you, who's at the front line of still treating it from the beginning and now. So what do you recommend to a patient who's home with COVID and worried? What do they do at home, and how do they know when to come to the ER?
That's an excellent question. And I think it's important to recognize that COVID is a viral infection. The first few days will be just like someone else who's had influenza or viral illness. So you may have fever, you may have body aches. The fatigue tends to be overwhelming for COVID-19 patients. There are some unusual symptoms that go with COVID-19 that we don't see in typical viral infections, such as the sense of you lose your sense of smell and taste, which can also be very alarming for patients. But I think it's important to recognize that for the first few days, what you need to do is do what you would do when you have a viral illness, which is get lots of rest, drink lots of fluids. If your body aches or if you have a lot of fever, then take Tylenol to bring down your fever, and try to give yourself rest. It's vitally important to get 8 hours of sleep for your immune system. So it's important to make sure that you have proper nutrition and proper rest. The timing that becomes alarming for patients with COVID-19 is once they haven't turned the corner after about 4 or 5 days. So if your symptoms are getting worse after the first 4 or 5 days, and especially if you're having symptoms such as chest pain, shortness of breath, or if your fevers are ongoing, that's when you really need to not only contact your physician, but I would say you need to be evaluated. And after about 5 days is when we have patients come in, get routine laboratory tests, get a chest x-ray, check their pulse oximeter, and then also do some special laboratory tests to check for the inflammation that may be going on in their body.
People are worried about getting it a second time. And do you think people can get it a second time? Has that happened recently? Or does it just go dormant and come back? And is this rare? I really want to help people with this fear.
It's not a virus that goes dormant and comes back. There have been cases where there have been reported documented cases where the patients have had it, got well, and then got a secondary reinfection with another coronavirus. The genotype, when the DNA was different, so it was a different strain altogether. So it is possible to get it a second time. In some of the patients, the second infection was actually asymptomatic, and it was diagnosed by, they were going into the hospital for a surgery, and then when they got retested, it was positive. And in a few of the patients, the second episode was actually more severe. I think at this point, it's still too early for us to know, but I think we all expect it to be a a virus that people can get again. And hopefully with the vaccines that come out, that will give us some protection, but it probably will not be lifelong.
All right, speaking of vaccines, of course, people are beginning to talk about, what do you think about taking it right away, or do you recommend people wait? What is the safety regarding a new vaccine for COVID?
So we had, amazing news come out a couple of days ago where the Pfizer vaccine was shown to be 90% effective in, preventing a coronavirus infection. That was an initial evaluation by an interim board. The full details of the study have not come out yet. It's currently finishing the phase 3 evaluation. I think right now it's still too early to tell one way or another because we haven't really seen the full data. But I think if I'm in a high-risk category, and those are people over the age of 65, 70, people with multiple comorbidities such as chronic heart disease or chronic lung condition or diabetes or cancer, those people, they've been in their house almost, as my parents say, they've been in prison for 7 months in their house. So I think for a high-risk patient, if there aren't a lot of side effects, and if it's a safe and effective vaccine, I think it would be definitely worthwhile to take it if it gives you some, aspect of a near normal life.
People are starting to fly now. They're starting to get out mostly because they have to for work or visiting family. What tips do you have for flying?
Again, over the past few days, a lot of patients have asked for, especially for Thanksgiving, if they can get together with their families. I know that a lot of college students are starting to fly back home. I'm still advising patients to try to avoid large gatherings, try to avoid travel, especially high-risk patients. If you're going to have to do it, so for college kids, what I'm recommending is that at least 10 to 14 days before their flight, that they really cut back on their social gatherings and going out with their friends, partying, to try to maintain, quarantine themselves as much as possible, and then to get themselves tested, with a PCR test if possible for a nasal swab. And then once they arrive, to again kind of isolate themselves for a couple of days. We know that when someone is exposed to the virus, it usually takes them 3 to 5 days for them to start developing symptoms. So, when you travel, you want to kind of give yourself a 3 to 5 day cushion to make sure that you don't develop symptoms. And then it's important, when you travel, to avoid using the restroom and to wear a mask, as well as, I'm recommending people wear shields and don't eat on the plane, because that would mean that you have to take off your mask. And, obviously practice great hand hygiene and make sure you wash your hands frequently.
Well, as you know, because you treated my father, my entire family got COVID except for me and my youngest son. And one thing you trained us for my father is to use the pulse oximeter, that device that goes on the finger to test oxygen. And that is what saved my dad's life, because day 9, as you know, his oxygen went down to 88. So if you can give us general instructions about that, and who do you recommend? Because none of us use it except my father. And I noticed you had told us do this during day 7 to 10 because of cytokine storm, perhaps bradykinin storm. However, I looked at your guidelines on your website. It looks like you're recommending, you kind of said it just now, 3 to 5 days. Did anything change?
I think the thing that we've learned is that, COVID-19, although, we can certainly treat it and we're not nearly where we were in March and April, it still is very unpredictable. And again, the earlier you could pick up the disease, and especially the patients that may be going into cytokine storm or bradykinin storm, and the earlier you get them into the hospital setting where you could actively start treating them, the better the outcome will be. So yes, the danger period is usually days 7 to 12 for when it develops. But what I'm recommending is around day 5. If you're not turning the corner, if your symptoms are not getting better, then to start checking your pulse oximeter. And if it's dropping below 94%, you really need to, have a discussion with your doctor. One of the things that patients do is they check it when they're at rest. And that's important, but it's also equally important to see what it does when you exert yourself, when you start walking around, because that's really kind of gives you a insight into what may be happening in the next day or two. So if you're exerting yourself, if you're walking and your oxygen levels are dropping, that's kind of an early warning signal for us. where we're going to be a little bit more aggressive with that patient.
People fear dying. That was their initial fears, and they still do, but there are people that also now feel, well, I might not die. I understand I have a very low risk of death, but I might get injured. So who is at risk of death or injury? Why do some still get injured or die today? And is it due to the wrong treatment or getting help too late? What are all the reasons for death or injury?
COVID-19, unfortunately, still remains a lethal disease. For those of your listeners that have anxiety, I think it's entirely valid to continue to make sure that you do everything in your power to prevent yourself from and your loved ones from contracting the virus. In terms of the patients that get the severe disease, the one thing that has held true to form this was heavily apparent from the early in March and April from our data from our colleagues in China and in Italy is the patients that are elderly. So people over the age of 60, 65 have a more severe course. Patients with underlying medical conditions. So again, diabetes, heart disease, lung disease, cancer, renal disease. Those patients, when they get the virus, have a more likely chance for having a more severe disease and ending in the hospital and succumbing to the virus. In terms of the cytokine storm, the interesting thing has been that patients with diabetes or even pre-diabetes and obesity, those tend to be a higher risk for patients to develop this part of the syndrome. And again, we're doing much better than we were in March and April in terms of treating patients and getting them out of the hospital. We do have multiple different treatment modalities that are available to us that were not available at that time, and we can go into that in a little bit if you wish. I don't think that people need to be afraid if they get the virus, that they think, oh my God, I'm going to die. But I think they still need to have a healthy fear of it and make sure they practice social distancing, wearing a mask, and washing your hands.
You mentioned obesity, which is a perfect segue into one of my clients' questions, and that is, what does obesity mean? Are people higher at risk just people who are chubby? In addition, how does COVID affect something unusual that we might not hear in the media? Someone who might be a drug abuser, an alcoholic. So really the question is about people who are really struggling already with their body perhaps being inflamed.
So obesity, we refer to it as based on a body mass index. Usually if your body mass index is over 30, then you're obese. But even if you're slightly overweight, it seems like you have more propensity for your body to have inflammation. And that's really the tricky part about this virus that's different than influenza, let's say. Patients with influenza may get a secondary infection with a bacteria, staph pneumonia or streptococcal pneumonia, or the influenza may cause an exacerbation of their congestive heart failure or their COPD, and that's really what causes them to succumb to the virus. With COVID-19, what happens is that the virus comes, and usually after about, again, 3 to 5 days, it starts going down. But in a certain patient population, it triggers this immune response, this hyperimmune response, where the patient's immune system, instead of acting in a coordinated fashion to kill the virus, to kill the infected cells, it actually starts turning on the patient and killing the patient's regular cells, whether it's lung cells or whether it's kidney cells, and patients develop this multi-system organ failure. And that's the part of the disease that usually happens in the second week of the illness. And that's the part that we're really fear for. And we want to pick that up as early as possible, get them in the hospital as soon as possible, and start actively treating it to prevent it from progressing.
As a hypnotherapist, Dr. Yadegar, I help people with their anxiety, and there are a lot of issues that branch off of that, whether it's weight or smoking and so many more issues. And today it seems like anxiety is contagious more than ever. I'm still seeing people who fear touching foods at the supermarket or their delivery packages or even restaurant menus. Should people fear touching things and catching COVID that way?
I think unfortunately, we in the medical profession didn't do a very good job, especially in the first few weeks and in the first month of this disorder. You know, it seemed like every day that you turned on the TV, there was another study or some other article about how COVID-19 spreads and how it hovers in the air for 3 hours or 10 hours, or how it lives in surfaces for 3 days or 5 days. And I think a lot of the anxiety that's out there was really due to, you know, poor, a lack of, you know, getting the right information out to the public. So I think, you know, that's something that hopefully this won't be the last pandemic, but more likely it won't be. And hopefully, you know, from the medical field, we'll have a better understanding of how to inform patients and not to scare the population. But I would say, no, this is, at the end of the day, this is a respiratory virus. So the way you're going to contract it is if you're spending time, especially with someone who is contagious, spending time in a close quarters, you know, within a 6 feet radius, and you're spending up to 15 minutes with that patient. That's where you're going to contract the virus. So I think, you know, it's unlikely that you're going to get it from food. It's unlikely that you're going to get it from the mail. But that doesn't mean that you shouldn't still wash your hands, especially before you eat. You know, you don't want to try to touch your eyes or your mucous membranes, because that could be a nidus of infection. But I think the vast majority of people that I talk to, my patients that have gotten it, they know who they got it from, and you know, they were in close contact with that person.
And some people, it seems like from the beginning, from what I saw, but more than ever, some people have an anxiety being outdoors. It's either for themselves or maybe they feel they're protecting others, but we see people now wearing masks on a walk, on a bike, on the beach. Can we catch a virus walking past other humans or biking past other humans while outdoors?
Yeah, I think, again, that's an excellent question. And I have had patients that have, again, contracted it in an outdoor setting. But again, what they did was they hugged each other or they were eating food together. So can you contract it while you're riding a bike outside in an outdoor environment? I think it's almost impossible to get it in that setting. You really need to be in close quarters where there isn't good ventilation, and you know, one virus cell is not going to cause you to get COVID-19. You need to be exposed to a certain amount of a viral load. And the other thing that we're noticing is that the viral load does make a difference as well, because, you know, if you're exposed to a higher viral load, then it's possible that you may have a more severe disease course. But your question is an excellent one, and I think an outdoor environment is very unlikely unless you're breaking the cardinal rules, which is, again, coming into contact with someone.
You mentioned hugging, so I have two questions regarding that. First of all, when my family, I thought our listeners should know that when my family got it, although I didn't and one of my sons didn't get it, we were visiting family at the time. And it's 60-year-old, 40-year-old, and 2 children about the age of 14. Our symptoms started at their home over the weekend. They didn't catch it. My theory is that indoor-outdoor that you're mentioning, their home is very indoor-outdoor, and they did catch it from us. So my question is, you mentioned a hug. Thanksgiving's coming. Do you think the person that you mentioned that got it potentially from a hug, was it a quick hug? Did they keep their distance after, or was this a face-to-face interaction for a while?
The case that I'm talking about was a husband and wife who contracted it from their son-in-law, and their son also got the virus as well, and they were having an anniversary dinner. They were celebrating their anniversary. And unfortunately, 4 out of the 10 people, 10 or 12 people that were there in an outdoor setting contracted the virus. And this was, again, just in an outdoor setting. But yes, if you break the cardinal rule and if you get into within 6 feet of someone and spend some time with them, you will contract the virus. For the majority of my patients that are high risk, I'm telling them not to have Thanksgiving dinner and to. I know that carving a turkey over Zoom is not the same, but it is the safest. And if you look right now, if you look across the states, you know, almost every state is having an increase in the number of cases. And true to form, over the past few days, we've also seen an increase in hospitalization. And if you check in another week or 10 days, there'll also be increased mortality, because this disease lags behind. So the patients that test positive today, you know, a certain population, a certain percentage of them will present for the hospital in about a week. And the people that are getting hospitalized, you know, it'll take another week to 10 days for them to unfortunately succumb to it. So there's a lagging period. And I think right now we just, you know, really need to be vigilant and continue to practice social distancing and keep with our own family unit and start not to start having social gatherings with other members of the families.
Speaking of family, who has diabetes, I have other friends with diabetes. It seems like this general term, I feel like the diabetics I know are very fearful. So what is myth versus fact? Would it be uncontrolled diabetics that are at risk? When it comes to diabetes, who's at risk? Who should feel a little more comfortable to have a somewhat normal life?
I think, you know, people who have their diabetes is poorly controlled are definitely at a higher risk. And the two things that I've seen is diabetes, but also with obesity. That seems to be kind of an exponential increase in your risk factor. So yes, if you do have diabetes, please make sure it is under control. You know, watch your intake and make sure that you're taking your medications and talking to your physician. And almost all of us are doing Zoom meetings and telemedicine visits. So I know in the first month or so, it was very difficult to get a hold of a physician, but at this point, it really should not be.
I thought a good example, if people were paying attention to some of the good news, was Tom Hanks. He has diabetes and he did well. I know other people who've gotten COVID with diabetes and they also did well in the end. They may have struggled a little bit, but in the end, they're fine now. And asthmatics also tend to be very fearful. Are they at greater risk of injury or death? And what type of lung patient is at risk?
So the one thing that was unique even in the first few days of the pandemic was that although this is a respiratory virus, although it does affect the lungs, it didn't really affect the asthmatics very much. I have had a few of the asthmatic patients who have gotten it and you know, have had a little bit of a bumpier course, but for what you would have expected, it doesn't seem to affect them as much as it does. The patients that are really high risk for this disease are patients with COPD or other chronic lung conditions who are on oxygen. So, you know, if you're on chronic oxygen therapy and you have a more advanced disease, those are the patients that unfortunately do not do well with this virus.
And people who have active cancer or cancer in the past also tend to be fearful. Now, my mother, I don't think you knew this, but she knew that she had COVID. You probably didn't know she had it very mild as a cold. My father also just had it as a cold. Those were their symptoms. But my mother had breast cancer in the past, and thankfully she wasn't so worried when she got COVID. But those who've had cancer, such as breast cancer, other cancers in the past, what type of cancer patients are at risk, should maybe be a little fearful, and who could relax a little bit?
I think certainly anyone who has cancer and is going ongoing therapy. So if you do have cancer and you're having chemotherapy, if you have cancer and your immune system is suppressed, so someone with like leukemia or something like that, those patients are definitely at higher risk. If someone had cancer 10 years ago or 15 years ago and is in remission, I wouldn't necessarily, you know, they have maybe a little bit higher of a risk factor, but it's not the same as someone who has active cancer and is undergoing therapy.
When I came to my father's follow-up appointment in July, and you had predicted most are going to get COVID by winter. Now we're seeing that schools are opening and then they're closing down when someone gets COVID. Should schools quarantine for 14 days, or how many days should they close down and reopen?
I think it kind of depends on the school and what's happening in the schools, but yes, if there is an outbreak in a school, I think it's safest to close down for 14 days. I think a lot of schools at this point have testing protocols that they have initiated. And not only that, they're keeping the children in pods. So if one kid in a pod tests positive, then they, quarantine the whole pod and test the whole pod. I think we're doing a better job with it. The interesting thing is that unlike other respiratory viruses, you know, COVID-19 doesn't necessarily affect the kids as much as you would expect it to. You know, we all think that at the beginning of the pandemic, we all thought that the kids would be a big nidus of infection and spread, just like every other respiratory virus that happens. But, you know, because they lack the receptors that this virus needs to get into the cells, kids that get it don't necessarily get it in a very severe case, and they don't become super spreaders. But that being said, doesn't mean that kids can't get it. Of course, you know, we've seen how the number of kids that have contracted the virus has picked up, especially college-age kids. So in dormitories, this virus, you know, as soon as you bring people together, as soon as they spend time indoors, this virus spreads like wildfire. So college-age kids are more likely, especially when they live in a dormitory, to contract this virus. But again, fortunately, they're young, they're healthy, you know, they do very well.
Do you think children should attend school for their mental health? I had a number of friends ask me to ask you this question because when they're in school, they're at risk. They are often in closed classrooms. They probably have to take their mask on and off, and people, I think they're brave. They're sending their kids to school. I do know one family that they've been home this entire 7-8 months. So what do you recommend? Should children be in school for their mental health or stay home?
I think when you look at the data, you know, we've had 10 million people in the States who have contracted the virus, 240,000 people who have died from this virus. But that's really just the tip of the iceberg in terms of what this virus has done from a socioeconomic standpoint, from a psychological standpoint to the community. That's something that's going to play itself out over the next few years, I think. But I think for children especially, you have to kind of break them up because there's a big difference between an 8-year-old and an 18-year-old. So I think, you know, children that are under the age of 10, 12, you know, third graders, fourth graders, maybe even up to fifth graders, I think they really require an in-person, you know, schooling, not just for their education, but also for, you know, in terms of their socialization, seeing their friends. I think when you're talking about middle school and high school and college kids, they can do much better with online and remote learning. I think when we're talking about elementary school kids, I think, you know, they really need to have the in-person education, and not just for learning their math and reading, but also for, again, you know, seeing their friends and for socialization. I think the one thing I would say is we should never doubt anyone's, you know, decision. So if there is a friend or family that are very concerned and they've essentially hunkered down and doing social isolation, you know, we shouldn't make fun of them. We shouldn't ridicule them. You know, all of us have different risk profiles. So for our family, you know, we decided early on that we're going to try to live a near normal life as much as possible. And my son, my 8-year-old, was actually, their school just opened up for in-person learning, and we didn't hesitate to send them. And, you know, we understand that the school is doing everything in its power to maintain a safe environment. But, you know, life does always come with risks, and there's a chance that he may contract it. But fortunately, in our family, you know, everyone is relatively healthy, and, you know, we just decided to live with that small but negligible risk.
I just want to check your timing because I know you need to get back to work and save lives. I have more questions, but what we can, I have a lot more questions, but if your timing is precious, we can just summarize and do a part 2 another day.
Yeah, I mean, I really want to get into the inflammatory condition and the cytokine storm, but I do have something else that I need to tend to, and I think that's going to, I would like to have enough time to educate your, you know, your viewers, because I think that's the really important part of this disease.
So I'll summarize by saying thank you, Dr. Yadegar, and just to keep in mind, Dr. Yadegar does have a website, which we will include in the links, but it's basically thomasyadegarmd.com, right?
Correct, Melissa.
And thankfully, Dr. Yadegar has guidelines for physicians. He also has guidelines for patients. And if anyone needs help with their anxiety and issues related to that, I'll also keep in the notes the method that you can get in contact with me as well. And thank you so much, Dr. Yadegar. Anything else you want to end with? Or
No, thank you so much. Thank you for all your help and support, and thank you for getting the information out there. You know, the more people we can inform, and if we can save 1 or 2 lives, and that's been, you know, an amazing success.
Well, thank you again for saving my father's life, and I really appreciate the good work that you do.
Thank you, Melissa.
Thank you, Doctor.
Bye-bye.